Hello, everyone. Welcome and thank you for joining the 19th webinar in our Pandemics and Society series. Today's webinar topic is Meeting the Challenge of Public Health, What's Ahead for Congress and the Administration. Today, we will be discussing public health, pandemic preparedness, and the state of play for legislation and policy in the field. I'll now pass it to our moderator, Jennifer Nuzzo, Director of the Pandemic Center and a Professor of Epidemiology at Brown School of Public Health, to begin today's conversation. Jennifer?
Hello, all. Welcome to our discussion. So, a new U.S. presidential administration and Congress were sworn in this month. And with any governmental transition, there are bound to be changes in public health policy. There has been a lot of speculation in the media and in discussions in policy circles and practice circles about what changes may come to pass for public health policy and funding. And so what we want to do today is talk about what's actually known. We're not going to speculate. We're just going to talk about what specific mechanisms we should be looking towards, from legislation to budgets, which ones are up for discussion, and what possible changes may occur as a result of those mechanisms. The goal for today is for us to leave the webinar with a clearer understanding of what we should be tracking. There's going to be a lot of noise, but we want to understand what should we be tracking as the transition occurs and what we should focus on in our efforts to improve America's health. And so to help us learn more about this topic, we're fortunate to be joined by two very seasoned policy experts. We're joined by Dara Lieberman, who is Director of Government Relations at Trust for America's Health. And we're joined by Perkins, who is the Director of Health Policy Strategy at the Center for Advancing Health Policy Through Research here at the Brown University School of Public Health. So thank you both for joining us today. And I just want to preface, before we get into our discussion, for those of you who may watch this webinar afterwards when we post it on our YouTube channel, I want to just say that this conversation is happening on January 24th. So the items discussed here may be dynamic and may be subject to change and may in fact change by the time that this is posted. We're going to do our best to kind of take that into account in our discussion, but I just wanted to kind of root the conversation in the timing of when we're having it. So as for proceeding, we're going to kind of kick off the conversation among us, but we very much encourage those who are listening in to use the Q&A function so that we can answer your questions later in the discussion. So let's dive in. And I'm going to open up to both of you, Dara and Jared, with just a general question. Is just like, what are you looking at? What do you think is the most important thing for people who care about public health and recognize that you work on different issues? But what are you looking at? And sort of what, if someone asked you, what should I pay the most attention to? What would you tell them? And maybe Dara, I'll start with you because you smiled.
Sure. I'm smiling because there is just so much going on right now. So as you said, it's rapidly changing. And those of us who advocate around public health issues are trying to stay as focused as we can on the big picture issues. So I'd say first up, we're paying attention to the budget process and overall threats and promises and opportunities for public health funding. So we know we're in the midst of all of that right now. The budget reconciliation process is the first thing coming up, where that's an opportunity for those who are in the majority in Congress, which is the Republicans right now in the House and Senate, to rapidly move some pretty big policy changes. So that could change the overall picture in how much money is available for public health and preparedness programs.
Yeah, and I'll just add on to Dara. I mean, the first 100 days it's always extremely busy, right? There's a lot of bill reintroductions. You get the hiring of new staff. Committees are trying to get new members up to speed. So there's a lot of action happening, at least at the congressional level as well. The other thing I'm monitoring too is in the lame duck session, they passed a continuing resolution that funded the government through March 2025. So during that lame duck session, there was the hope for an expansive bipartisan healthcare package, but ultimately they only found consensus on extending certain expiring provisions. There's already been talks by like Reps Buddy Carter and Diana DeGette, who are top members of the House Energy and Commerce's Health Subcommittee, to restart those discussions on the bipartisan healthcare package. So there's no really specific legislative path that was agreed upon, according to the Political article, but both lawmakers have expressed optimism of moving forward some kind of package like this. And during the the lame duck session, there were several reauthorizations like the Pandemic and All Hazards Preparedness Act that were included in there, which is a big comprehensive bill around the pandemic preparedness. And then there was also like the Support Act reauthorization, which is a big comprehensive bill around opioids and substance use disorder, and then things like PBM reforms and telehealth extension. So really paying attention to see as they kind of start negotiations again on the fiscal year 25 bill as appropriations bill as the expiration comes in March to see what they might include there related to healthcare.
Thanks. I'm glad you brought up the budget, Jared, because I think that's something that, I think is an obvious place for us to want to look. And maybe just to kind of go a little bit further, for those of us who don't fully understand the process, particularly given sort of where things were before the transition. Sort of, can you give us sketch out, both of you or whichever one of you, sort of what is the timeline that we're talking about, and particularly for groups that may want to make some kind of influence in terms of what should be in the budget or not, like sort of what's the calendar that you're looking at?
Dara, do you want to go ahead first?
Sure. So it is a little difficult to say because it's not a straight line. I have a good graphic on this that shows arrows going every which way. And this year especially, we're going to see an overlap of fiscal year 2025 with fiscal year 2026. So because the last Congress did not complete the appropriations process around fiscal year 2025, which technically began October 1st, they're also formulating the budget, which is the president's recommendations for how much funding there should be for different programs for fiscal year 2026 at the same time. In a normal year, we would be advocating around appropriations, which is the money that Congress actually provides to those programs. In February and March, you would see the president's budget request come out in sometimes February, sometimes later, and much later, usually in a presidential transition year. And then, Jared, do you want to talk about the layering in of the reconciliation process on all of this?
Yeah, so I mean, what they're going to be kind of focusing on now too is budget reconciliation to renew a lot of the Trump tax plan that was also passed during one of the last reconciliations under the last administration. So that process is basically a process that is kind of a critical lever for passing major policy changes because it only requires a simple majority vote in the Senate. And isn't subject to filibuster. So it's kind of a special process that allows legislation related to taxes, spending, or the federal debt to pass with a simple majority in the Senate. And it has to go under for certain reconciliation instructions and rules. And this has been used in the past for like the parts of the Affordable Care Act that were done in 2010, the Tax Cuts and Jobs Act in 2017, and then the American Rescue Plan in 2021. So there's potential opportunities for like healthcare spending type bills to get included in there, whether it's like cuts to Medicaid or site neutral payment reform. So they're going to be kickstarting the process on that, I believe, at the beginning of February, and then with the hopes of having some kind of finalized document by the end of March, I believe.
And Jen, to address your other question about when groups should be weighing in or individuals should be weighing in, anytime is a good time. Now is a good time to contact lawmakers and tell them how federal spending impacts what you're doing in your community, your research, wherever you may work, and what the impact of a cut could mean. What would you lose and what it would be lost in their communities and to their constituents.
So not wait for a particular like window of discussion, but just anytime, just engage. And
yeah, I mean, I think the spring is usually when we would encourage, early spring, early first quarter, but because the process is really year round these days, it's not too late.
Okay, that's good to know. That's good to know. Jared, you mentioned some things that you're looking at, particular areas of the budget. I wanted to focus, given the interest of the Pandemic Center, on the Pandemic and All Hazards Preparedness Act, and sort of would love to get kind of an explainer on where things are for people who are listening. But Dara, what else are you looking at? Anything else in particular?
Well, of course, we're monitoring the Pandemic and All Hazards Preparedness Act. We saw they extended some of those provisions through March with the continuing resolution. We're also monitoring the nominations of the HHS secretary, the CDC director, and other key roles that the Senate will be considering and voting on over the next few weeks. And then they're going to hit the ground running on budget reconciliation.
So on the Pandemic and All Hazards Preparedness Act, which for people who may not know, this is like one of the, well, I'll let you all explain it, but I'll just say my familiarity with this is that this was really important legislation that helped not only define the work of federal agencies on preparedness, but also creating funding mechanisms for state and local partners to be partners in that work. And really, I think a critical part of setting a common set of understanding of what work we should all collectively be doing to improve U.S. preparedness for not just infectious disease emergencies, but also natural hazards and other things. And so I believe that bill was signed into law initially in 2006. Correct me if I'm wrong, and has been reauthorized since then. But there has been some challenges as of late. So I'll let you kind of talk, and then whoever wants to weigh in on that, but just maybe if you can explain it for people who are watching who maybe aren't as familiar with that particular legislation.
Yeah, I mean, I can just say, as you mentioned, it was one of the federal laws that was designed to enhance the nation's ability to prepare for and respond to public health emergencies, and really focuses on strengthening the public health system, improving a lot of that coordination across agencies. Last year, this has always usually been a fairly bipartisan bill that has had bipartisan support in both the House and the Senate. I think some of the challenges that it faces now, Anna Ashu, who used to be the subcommittee on health director for our subcommittee on health chair for our ranking member in the House Energy and Commerce Committee, recently retired and left Congress. So I believe they might need a new House lead for this bill as well. And then a lot of the hang up last year was some differences on opinion on whether to include provisions about drug shortages into the bill. House Democrats really wanted that included, and House Republicans did not. So that's kind of the best update I have. Dara, I don't know if you want to build off of that.
Yeah, I think that's all accurate. Just for your listeners here, just to explain the difference between authorization and appropriation. So an authorization like the Pandemic and All Hazards Preparedness Act tells the federal agencies what they should or must do, but it doesn't actually give them the money to do that. That requires an additional appropriation by Congress. So just because we're late on reauthorization of PAHPR does not mean that those programs within the bill are going to cease. So the Public Health Emergency Preparedness Cooperative Agreement, PHEP, the Hospital Preparedness Program, HPP, I'm sure there's many others within the bill that the listeners care about, but they will continue so long as Congress continues to fund to fund those programs. There are some things that would stop without additional authorization. So some of the federal advisory committees, temporary reassignment of workers at state and local health departments, but Congress so far has extended those within the continuing resolution.
Yeah, and I believe sometimes the reauthorizations also give them the opportunity to kind of build and improve like some of the existing programs as well.
And aside from just watching to see if it will be, I know we're not going to speculate, but it was very helpful to hear, Jared, your take on what was the holdup last time, and just wondering if you have seen anything that would change predictions on that, such that people should be aware of.
I believe when it was introduced, and Dara, you can correct me if I'm wrong here, during the healthcare package that was introduced during the lame duck session, they removed the drug shortage provisions, correct?
Oh, you know what? I can't remember. It was so long ago.
Yeah.
Like a month.
Yeah. So I think that my assumption is that they had put the PAHPR reauthorization there, more of a clean reauthorization, basically.
Closer to the Senate bill.
Yeah.
So it sounds like there might be some improved hopes on that front.
Yeah.
Okay. That's good. That's good to know. That's good to know. Great. There's also been a lot of attention this week on executive orders, and realize that not a lot we've seen so far particularly health specific. However, just again, for people who are listening, if you can just kind of explain what an executive order is relative to legislation and just what that means, just as an explainer.
Yeah, I'm happy to kind of dive into this a little bit. So their executive orders are official directives by the president to kind of manage operations within the federal government. So they're one of the tools the president uses to kind of implement their policy agenda, often when like legislative action that Congress is stalled or not feasible. So unlike laws, which are passed by Congress, require the president's signature, executive orders don't go through the legislative process. So instead, they're issued unilaterally by the president based on the authority granted by the Constitution and kind of existing statutes. So they have the force of law, but they're kind of limited in scope. They can't create new laws, override existing ones, or appropriate funds because that authority is reserved for Congress. So instead, they're typically kind of directing federal agencies on how to implement or enforce laws that are already on the books. So an example is executive order might instruct agencies to prioritize certain regulations or policies within their jurisdiction.
Okay. Anything to add on that, Dara?
No, that was outstanding.
And so for people who are looking at the executive orders and are particularly either in favor or opposed to the ones that are being issued, like what is the adjudication? Is there an adjudication process? What are the adjudication process for people who want to, push back on or change the direction of? I know that there's been some headlines about some already having legal challenges. So does anybody kind of weigh in on like the checks and balances aspect of that?
I don't have a ton there, Dara. I don't know if you do.
I don't either. I mean, we're a bit in uncharted waters, but
yeah. Well, maybe just even taking a step back, given both of your experience in sort of health advocacy and how much of like one could imagine that letters, for instance, to elected officials may play a role, or writing persuasive arguments, or just sort of like what are the general categories that advocates would use regarding executive orders, if I can make that more generic.
I'm sure we will see litigation surrounding some of these executive orders. We're already hearing rumblings of some litigation. And then the other is, I do think that if people weighed in with their members of Congress, as Jared said, there's no funding attached to executive orders. So if an executive order were to try to establish some kind of new program, that would require congressional action.
And maybe to an extension, and I don't know to what extent you can answer this or if this is truly answerable, but I have heard that if Congress authorizes a particular program, and if they have provided money for a particular program and it's listed in the budget, even if an executive order says we're not going to do this, or like how do they relate if there's potentially a disconnect with what Congress has outlined either in authorizing or in appropriations language?
That's a huge question right now, because the position of the Trump administration and the nominee for the Office of Management and Budget, which is the executive branch's arm of the budget process, essentially, their position is that they can order already appropriated funds not to be spent. So we saw an executive order this week that limited spending on some of the Biden era programs around that were called like the Inflation Reduction Act, the bipartisan infrastructure law. I think those executive orders were focused on energy policy, and so we could see more attempts at that. It's the position of, the Constitution gives Congress the power of the purse. So we really haven't seen that power questioned to this extent before. So we've already heard from the Democratic leaders of the House and Senate appropriations committees questioning that position of the Trump administration. So we could see, again, litigation, hearings, media attention, and attempts at congressional action.
Yeah, I don't have a ton to add there.
Okay, that's helpful. Also, a lot of attention this week on directives about federal agency communications, health agency communications, and also engagement with partners. There's been a lot of media reports about travel restrictions. And just to say, there's also been some question of, well, is this unusual, or is this just what happens at presidential transitions? I have strong thoughts about it, but I'm curious if you have thoughts that you are able to share in this setting that you'd like people to know about these sorts of transition timed communication changes. I will just say, I'm going to weigh in here and I'm going to start it, which is just to say that yes, changes occur when there are presidential transitions, and of course new teams come on board and they just want to get a lay of the land for, you know, making big announcements that may have been planned by a previous administration. I think based on the feedback that I've personally gotten from people who are working, and not necessarily just federal workforce, actually state and local workforce, who you know, have been around for a long time and have observed multiple presidential transitions. To them, they are a bit alarmed by the amount of activity that has been ceased, including scheduled, you know, partner meetings that were meant to exchange information about what's going on in terms of health crises like H5N1. So I have to feed off of that energy, which is just that people are quite concerned about that. I think the concern is not only that, like, very, very routine and what you would also think of as mundane things like a briefing on H5N1 being, you know, briefings being canceled, but also just some uncertainty over when we're going to return to business. I think that's the other area of concern, just the lack of kind of transparency about that. There have also been concerns about, you know, jobs being taken down from USA jobs, and these are hires that are obviously important for work that's ongoing. So I think it's based on that I think people are concerned. I do think it's also possible that some of what's happening is just lack of clarity around the order, such that agencies may not know how to properly interpret it, and may be putting on hold things that weren't intended to be put on hold. And I think there have been some indication that's like NIH study sections that might not have needed to be put on hold. And I think, you know, as agencies kind of hear pushback or hear attention on this, may take a second look at what they've put on hold. But I would just say that I think, based on my conversations that I've had, and also just what we've seen in the past, this does feel a bit different to me. Anything else either of you would like to add to that?
Yeah, I mean, oh, sorry, Dara, go ahead.
Okay, no, I agree that it's hard to say how much of the nitty-gritty in the pause has been interpretation by those who are in acting positions right now versus what has really been explicitly ordered. And we know that there's no full-time HHS secretary in place, so some of that may be interpretation. But yeah, I agree that some of the pauses have been unprecedented. Like this was the first week that there wasn't a CDC MMWR published, so that's very unusual. I think the USA Jobs issue you were speaking of, related to the president's executive order pausing or implementing a federal hiring freeze. So we've read articles about some of those positions being taken down, and hopefully that would be temporary as well. It is hard to predict, though, what transitioning out of this might look like.
And maybe just to add to that particular point for people who are listening, in some cases, when we're talking federal jobs, these may be federally supported jobs that are rooted in communities. So they may be serving, say, local health departments, but they're technically federal employees because they're tied to federal funding.
Yeah, and I was just going to add, like, some of the pending of like regulations and like proposed rules and things like that, I think is usually normal when you have the transition. But I think probably a lot of the concern relies around like the external communications. And if it rolls past the February 1st deadline of what the pause is, I'm sure people will have concerns about like the dissemination of critical health information, like the food recalls and updates on infectious diseases, as you kind of mentioned, Jen. So I think that's kind of where the major concern lies.
And I'm going to just queue up here a question that we got in the Q&A specifically around this, which is referencing that there was a flu information had not been updated, which is sort of off timing. And I will say, I think not updating data is particularly concerning because we are in a very critical period for public health. This is one winter respiratory virus season. The flu season got a late start, and so we're just now trying to see the impact of influenza and flu vaccinations on communities. And so delays in data are costly in multiple ways. The other thing I will also say is that we are actively tracking an emergent and deeply serious, and I will say costly, situation with the H5N1 avian influenza virus. And the only way that we can make sure that this virus doesn't threaten public health and tank our economic interests is to have data to track it, to stay ahead of this virus. There are a lot of questions about this virus, one from a protecting our agricultural interests and agricultural competitiveness aspect, also protecting the cost of people's groceries. I know if you've tried to go and buy eggs, you have seen already what this virus has done. But also wanting to stay ahead of this virus so that people don't get sick and die from it directly, but also so that it doesn't evolve to become potentially capable of causing a pandemic. So I think sometimes when leaders get into positions, sometimes they start to see data as the enemy, but the data aren't the problem. It's the problem that's the problem, and data are the way that we get out of the problem. So that's just my editorial comments related to that question. I will also just say that in an era of information exchange that we have, I just think there is no hope that data could ever be withheld in perpetuity. Data will get out. And as we saw during COVID, there were just a number of really well-skilled groups, including my colleagues at Johns Hopkins that stood up the COVID map and others who, just not seeing federal action, decided to take data matters into their own hands. Now, I don't think that's always ideal. I think it's better when health agencies or government agencies that understand the data best are the ones updating the data and explaining it. But if the data aren't updated or explained, other groups will just emerge to put their own explanation out. And I just don't think that's in anyone's best interest. So anyway, just wanted to add that and then give Jared or Dara any other opportunities to weigh in.
Yeah,
Nothing to add for me.
Yeah, nothing either.
Okay, great. Let's see. What else are we? Let's see. I'm gonna go now to some of the comments, that some additional questions that are in the box here. Question about WHO and the withdrawal. I guess I don't know what to ask you here other than it happened. Maybe just any insights on sort of timing and I don't know, any insights on potential impact of that. It's okay if not.
I believe it's effective immediately, right, Dara?
I think there's a year transition.
Yeah, I think it's
Okay.
next January.
Okay. Yeah, I mean, it's the decision halts U.S. funding to the organization. I don't really have a ton of insights there on that as well. Just I don't know if there's really any action that can be taken to really fight against it. Dara, I don't know if you have any insights.
No, I mean, I couldn't tell you, but I guess Congress can appropriate funding. Although I would not anticipate that in a Republican Congress right now. But yeah, we anyone who's observed the COVID pandemic and other global health emergencies knows that global cooperation is very important, and we can't expect the U.S. to go it alone in future emergencies. So our global responsibility will come back to the United States at some point. So we'll see what those implications are and how this would actually be rolled out. But it certainly seems like for now, that's the policy.
Yeah. I mean, maybe I'll just add some more editorializing here, which is just to say that, there are deep interests for the United States to be part of the conversation that WHO brokers with other countries. One is that we, have historically been able to help shape that work and make sure that our priorities are part of that work. And I think one area of particular where U.S. leadership has been quite important has been to make sure that efforts to improve other countries' capacities to detect infectious disease threats that may spill across their borders, that those are built around the foundations of biosecurity, making sure that what happens in laboratories is safe and can't escape. So, I think the US stepping back, just, there are questions about whether that's in our, I wouldn't say that's in our best interest to make sure so that continues to be part of the discussion. I don't say it creates just a vacuum for other countries to step in and fill. And again, that's just reduced influence. We also rely on WHO for a lot of things. I mean, first of all, I think the global surveillance system for influenza that informs the composition of flu viruses, is critically important to the US and to the companies that operate here. So, there's a lot that we depend on, and the list really goes on and on. I would say, though, that what I haven't heard is debate as to whether the work of WHO is necessary. I think there have been some argument that, well, we'll just build it elsewhere. And I would say, to me, that's a recipe for spending more and getting less, building something from scratch as opposed to working to improve the one you have. I think that would be my concern there. Anything else to react to or add?
No.
Okay. Somebody shared, it says, for your situational awareness, HHS just announced the appointment of Susan Menares as Principal Deputy Director, Office of the Director of CDC. As first assistant to the director, she will serve as acting CDC director and ATSDR administrator as of January 3rd. So I'll say that my reaction is that's great news. Susan is excellent. I've known her for a long time. She is excellent. And I think that's also excellent that this has been announced, because yesterday there were questions from reporters as to who was the acting CDC director, and they weren't able to get answers to that. And, that's exactly, I think, some of the concerns about the pause in communications. For preparedness sake, we need to understand who's in charge and to whom needs to be direct questions and who has the responsibility, et cetera. And so just when questions about responsibility swirl, preparedness suffers.
I will say that they did announce the NIH acting director as well today.
Great. Any reactions? Anything?
It's Dr. Matthew Mamoli, who was NIH an intramural researcher, and he's going to be the acting director until the confirmation process of Jay Bhattacharya.
Yeah. Great. Okay, I'm scrolling down here to see what else. A lot more questions about WHO and what the impact will be in terms of low and middle income countries. Questions about, a lot of these are like speculation questions about like what this will do for the role of like philanthropies. Like, will they pick up the slack? I mean, I don't know that anyone can really speculate here. There is a note that WHO executive order includes withdrawal from the pandemic treaty and the IHR negotiations, and what would be the second order implications of such action. I mean, I think, unless you all have something to add, I will say that there's a lot that we just don't know, I think, but the overall kind of expert view of the community that works with these organizations and have engaged on these issues is that losing a seat at the table is not aligned with US interests, that this will undermine US health and security. Okay, I'm just trying to see what else is here. Any other questions that we can get to? And please, if you are seeing things that you want to weigh in on, please chime in on them too. I would love, just kind of maybe stepping back a little bit, just there's a lot of folks on this webinar who are clearly very activated on these issues. And like, what would your piece of advice be to them in terms of like, what if they are going to go forward, that they should be spending their time looking at? I know there's going to be a lot of headlines as of late. Where would you suggest they look for their information or track their information? What would be the thing that you would focus on? And recognize that you work on different issues, and it's okay. It doesn't have to be pandemic related, but what are your thoughts?
Yeah, I can start with a couple of areas. The first, I think we've talked about a few of them already, but the president's budget. So that's going to be the critical document that really outlines the administration's priorities and their policy goals and their vision for the country. So it kind of serves as the blueprint for federal spending, provides detailed proposals on where resources should be kind of allocated across agencies and programs. So really kind of paying attention to that and what the key priorities might be there. I'd say committee activity. So the healthcare committees of jurisdiction, just really paying attention to the hearings, the markups, any reports in those relevant committees, as they're often driving kind of the legislative agenda in health policy. And then, as I mentioned earlier, like a lot of members right now are introducing new bills. So looking at those introductions of the bills and resolutions related to the areas that you are interested in. So finding the ones that have like strong bipartisan support or sponsored by committee leadership are really particularly worth watching, because those are the ones that like have the best likelihood to move forward. And then we've kind of talked about the appropriations process and budget reconciliation. So keeping an eye on those two areas for appropriations, just to see the funding levels for the key programs that you're interested in. And a lot of times those appropriation bills can have policy riders that really kind of influence implementation or priorities. Yeah, those are kind of the main ones I can think of.
So yeah, I'll recommend a few resources that I think would be helpful for the audience. I think there's several newsletters that I find helpful. One is Trust for America's Health. My organization has a wellness and prevention digest you can sign up for on our website, where we inform folks about various health policy updates. We'll share resources from other public health advocacy or other organizations, mostly DC based. And we have a health security update as well that's more on the news side of things. Center for Health Security has a great, and CIDRAP both have good health security focused newsletters. And your local epidemiologist, I'm sure folks know about, but I think she has very good explainers in plain language about what's going on. In terms of what folks can do proactively, as I said, do not hesitate to be in touch with your lawmakers. I think a lot of times folks in public health may think that they are not allowed to speak to their lawmakers if they're government employees, but you are allowed to educate your policymakers. They have to know what's going on in their states and in their jurisdictions. So tell your story as much as possible. Make calls, have them come visit your site. The more education you can provide, the more they understand what the implications of these policy decisions will be to their constituents.
Yeah, and I'll just build out that, because Dara, I think you made a really good, excellent point on the need for education. When you have a lot of new members, you have a lot of staff turnover on the Hill and in the federal government. Like they're looking for evidence-based resources to really educate them about the issues that they're most interested in. So finding ways to get in and meet with staff and those kind of things to really bring them up to speed on the issues, I think is huge.
The other piece of advice that I would provide, and I'm trying to tell myself this too, is to stay focused and not react to every single thing that happens or that you see on your social media, because there's so much happening so quickly right now that it's very easy to get overwhelmed. So staying focused on those big picture issues that impact your work are probably good places to start.
There are a lot of questions here about funding and like, what should we expect cuts? Should we say, and I know that we're not going to speculate, but I guess my question is, given how many questions we have, and it's a very reasonable question, is what are you hearing about funding? Particularly, these are questions about funding, federal funding to states for state efforts. We know, I have to stress that we know that U.S. public health, first of all, most of the action is done at the state and local level. However, federal funding is the foundation of those activities. So what happens in your communities is deeply dependent on federal funding. What happens to the country, that roll up of all of those activities, is deeply dependent on federal funding. And so the question, I guess, is what should we expect to see regarding, or what are we hearing regarding that funding? I mean, I would say I personally have not heard anything that makes me feel great about it, but just can you offer any more specifics?
I can start, Jared, and then turn to you. But yes, federal funding is deeply important. I mean, some states, 80% of their budget comes from federal sources. It's at the state level, the state health department level. 80% of CDC's domestic budget goes out the door to state, local, tribal, territorial, and non-governmental organizations, including universities and faith-based and community-based organizations. So we're not just talking about agencies that are in Atlanta or in Washington that are impacted, but really the work on the ground, as you said. So my organization puts out a couple of reports that might be of interest. One, we do an annual report called the impact of the chronic underfunding on America's public health system, where we track public health funding issues over time. The other is we just put out in October a blueprint for the next administration in Congress, which we're currently in. And we focus partially on some of the funding cliffs that we could see as a result of the expiration of COVID era funding. So we've, it's been a great success story. Major investments in public health infrastructure, workforce, data modernization. So, if some of those are allowed to expire, we could see serious drop-offs and attrition. And then we're also seeing proposals for elimination of some public health programs or entire centers at CDC. Last year, the House appropriations bill for HHS would have eliminated the CDC Injury Center, which is where not only injury prevention is, but opioid overdose prevention, suicide prevention, other programs that really impact every state. And we know that the work of, I know we're focused on pandemic preparedness today, but those are very interconnected issues. Chronic disease is very interconnected with infectious disease. The health of communities is directly tied to our resilience for disasters. So that's where my organization is focused on overall public health funding.
Yeah, the only thing I would add is that I try to stay cautiously optimistic because I do a lot of monitoring of kind of the committee assignments and the key leaders are for the committees, and looking at the appropriations committee, like you look at Susan Collins and Tom Cole, who are the Republican leaders in the House and the Senate, oftentimes are very pro-science. So when we start thinking about NIH and CDC funding, they have always been extremely supportive of those in the past. So I try to stay cautiously optimistic, although of course concerned when you see some of the proposals that are out there. But I'd say that's kind of where my head lies.
And we also have seen that acknowledgement by the House Speaker Johnson that there will need to make this a bipartisan bill, the appropriations bill, in order to pass. The majorities are so slim right now that there will need to be some Democratic votes to get this passed.
And maybe just a very obvious statement, but I'm going to reiterate it, is just, I think it's incumbent upon those of us who understand how these programs work and what their impacts are to really make the case for what it does for the communities so that legislators see it not just as a national policy issue, but like what it directly means to their constituents. I think NIH funding is a particularly compelling one, which is just what it returns to the US economy in terms of, the overall U.S. economy, but also its local economic benefits that really kind of go beyond just, paying of people, but making it such that states are places where people want to live because there are job opportunities and exciting work to be done, et cetera. So I think, when there's lots of questions here about what can we do, I think it's on all of us to go into education mode and just to explain what this means in very real terms for everyday Americans. There was a specific question about I think maybe reacting to something that said, but what funds can be clawed back? What's the definition of obligated? Anybody have thoughts on that?
Not that I can think of on my end.
Usually it refers to funds that have left the agency and they've been determined for a certain purpose. I think there is now debate over what that means. So that's, I think, why Jared and I can't quite answer that definitively.
There are, I'm looking here. Here's a question that looks like it's meant for you, Jared, which is, do you have any concerns on the proposed risk pooling for health insurance coverage in relation to public health? Do you believe this will make health access unaffordable to our most susceptible community members? Any thoughts on that?
I don't have any thoughts specifically on that.
Anybody? Okay, maybe it's outside of our tracking areas. Apologies if I thought you'd be on that. Well, I guess maybe to say, what are you thinking? Like, what are your kind of policy, like, what are you hoping to stress in terms of when you have conversations on the Hill and with policymakers? You work, just to say that Dara and Jared work on different issues, but Dara in particular working on healthcare and healthcare affordability.
Yeah, I think you kind of hit it there at the end. Is like a lot of what we're focusing on is healthcare affordability, because like healthcare wasn't a huge topic in the election, but I think voters seem to be concerned about the economy, and when healthcare costs kind of falls under that bucket. So a lot of the research that we're doing is kind of in ways to address healthcare consolidation to kind of lower costs, improve quality of care. The other areas that we're looking at is like Medicare Advantage overpayments, looking at the federal government overpaying for MA plans for specific amounts. And then I'd say the other one is we have a lot of work on site of care payment differential. So looking at how much services cost at, say, a hospital outpatient department versus an ambulatory surgical center, and thinking about how you can kind of bring those payments more in line. The costs are higher at HOPDs versus ASCs. And so looking at things like site neutral payment policies, which would save the federal government a lot of money, are something that's being considered for like budget reconciliation, as well as like a cost saver. That's something that could also impact costs and also address healthcare consolidation as well.
And I think where my organization, our advocates are focused right now on the Hill is educating lawmakers and their staff. As Jared said, there's so much turnover about what do we mean by public health, governmental and non-governmental. What are they doing in your community? Mm-hmm. And just starting with that basic education, because there's so much, in media, social media, misinformation about what public health means. What they can and can't do, and so we'll be doing a lot of education about why it's the structure and mission of CDC, for example, are the way they are, and how that impacts the health, economic, and national security of each community.
Yeah, and on that, I mean, I think that is necessary. It's clear that that's necessary regardless of who would have won the election. I mean, I just think that one of the things we've seen as a result of the pandemic is just a lot of kind of misunderstanding of what public health is and what it does. Obviously, when it shows up in an emergency, that is not the same as what it does day to day. And I think there is an important educational opportunity for people to better understand. Along those lines, there's a question about being concerned about the privatization of public health. And maybe that parallels some of the concerns about the privatization of the private sector nature of healthcare and increasing kind of changes in that business environment. I will just say that public health is a public-private enterprise. I mean, the extent to which it involves the members of the public, and the members of the public are, some of them work for private sector organizations. Private sector organizations cannot function unless there is public health. So it is an enterprise that involves both. Obviously, there are inherent governmental functions related to public health. As far as the federal government, those functions generally center around interstate issues, whereas, the primary responsibility for public health does rest on the state and local level, just given that we are a federal country. So I'm not worried about the privatization of public health so much as I want private sector partners involved in public health, because they have an important voice, because they cannot operate, they cannot continue to function. They cannot take care of their employees, take care of their customers, et cetera, unless there is a functioning health, public health in their communities. And I think going forward, some of the conversation is going to be about the role of, kind of bottom up preparedness, not just like this is what the federal government tells you states to do or you communities to do, but for communities to define what level of preparedness is acceptable to them and who are the partners in building that work. Government can't do it all. It could never do it all. And I think it's a fallacy to kind of argue that it should have ever done it all. So I do think we have to diversify who's involved in this work. But anything either of you want to add to that?
Right, I agree with that. There's certainly roles of governmental public health that cannot be replicated or privatized, because data being a great example, because we need that information to be available to possibly competing interests like different hospitals. But there's so many private sector entities and constituents that depend on a functioning public health system. The private healthcare system being one of them. We've seen the TIFA is involved in the Common Health Coalition, which is between healthcare sector and public health, who are focused on strengthening public health and really illustrating the interdependence of those two sectors. There's other private sector entities that have risen around the same issue. My organization puts out a preparedness report every year, and we focus on not just the role of governmental public health, but private sector as well. One of the data points we track is whether employees have access to paid sick leave. We know if you're sick, you need to be able to stay home, and that protects the employer, the employee, and the customer, and is an important public health factor, but it's really up to the private sector to make that happen. So that's just an example of ways that the bottom-up approach, as you've mentioned.
And maybe I'll just add another dimension to this, which is, I do think we as a community need to do a better job of like the economic case for investment in health, and why, it's not a trade-off between health and economy, that those two things are directly linked. I think we have to make a clearer case of that, because there is a very clear case to be made. But also to say that for those of us in pandemic preparedness and health security, there is a national security aspect to this. And, I got my start in public health in the aftermath of September 11th, and seeing how questions about whether the United States was going to be attacked by an adversary very much motivated changes to our public health infrastructure. Public health pre-2001 was a much different beast than it was after 2001. There was the events of 2001 really made very urgent the idea that we needed a public health system that functioned 24/7 and not necessarily during regular Monday through Friday business hours, making sure that we had data to understand what was going on in our communities and to spot when something was off normal, and then to be able to act very quickly to mitigate the impacts, not just to protect people, directly and health, but as a deterrent to those who would seek to harm the United States, so that we could say to the rest of the world, don't harm us, because if you do, it will not have the kind of impact that you're hoping for. So I do think that, there is a very strong national interest case to be made here. And I think we have to make that clear, particularly given that many people, I know this from being a professor, weren't even alive in 2001, and don't actually understand how difficult it was and what we were very concerned about. So I think that national security piece is a really important aspect. Public health preparedness is a deterrent. Okay, I'm just scrolling back here and trying to see anything else. There's some more questions about what people can do to get involved, and particularly sort of young professionals. You may all have some thoughts. I will just say, and I will add to the list of resources. The Pandemic Center has a tracking report, which is our attempt to kind of understand what's going on from an infectious disease, public health preparedness standpoint. We were just getting it was getting too difficult to stay on top of all of the health emergencies that were occurring both in the United States and around the world. So that's our attempt to make it easy for you. So just to say, if you're interested in staying informed, please sign up for our tracking report newsletter. We put out this week a really great, I think, explainer on wastewater surveillance, particularly relative to H5N1. In terms of, we are trying to educate and train the next generation of decision makers. And so we have a biosecurity game changers program, and that group of early career professionals is doing great work on their own, but also great work organizing the broader community. So they hold regular sort of informative webinars and other things like that. So just encourage you to follow our channels to learn more about those things. They just had a great webinar on wastewater surveillance. But anyway, Jared, Dara, anything you'd like to add in terms of, young professionals who might be at this moment in their careers thinking, oh my gosh, what did I get myself into? Are these bleak days? Anything that they can do to stay informed, engaged, and sort of activated?
Dara, do you want
to? Yeah, in addition to the Trust for America's Health resources I mentioned, like our newsletter, if you're in a membership organization, ASTO, NACHO, Big Cities, CSTE, APHL, APHA, they all have great grassroots resources. My organization doesn't have a membership, so we really depend on our partners that have members like you. And they make it very easy to contact lawmakers. But even if you're not a member of those organizations, it is very easy to go to your member of Congress's website, email them, call them, and just say, I have XYZ concern. Please fund this program or overall CDC, NIH, the programs that you care about, and here's why, and here's how it impacts our community.
Yeah, and I just agree with Dara there, is that the more that members hear from their community, the more likely they're going to do something about an issue because they're hearing from their community. So find ways to reach out, whether it's letters, phone calls, those kind of things.
Great. Excellent. And anything else that you would sort of want to stress with this group of now over 300 people who are listening live and the many hundreds that will listen online about, what you've seen, because you've both been working in this field for a while. You've seen transitions happen in the past, maybe some like kind of larger picture, given I think you could sense a lot of anxiety in the Q&A here, just larger insights about this moment that we're in and sort of going forward. I think maybe building off Dara, your excellent point about, don't react to everything, but any other advice you would give people, particularly, I think that the folks who may be particularly anxious about their role in this field, given these changes.
Well, I would say that the fact that you're all here and that you've, for most of you, chosen careers in public health and related fields shows how much you care about this country and their community. And it's together, we really can make a difference. It sometimes feels like we're less powerful than the other advocacy sectors out there, but together we make it a lot easier. And I think it's really helpful for all of you to look around and see that there's so many people in the same boat as you and all feeling the same kinds of anxiety, and just take it day by day and take deep breaths and take care of yourselves.
Yeah, that was going to be my same advice, is just kind of take things day by day. That's kind of what I've told our researchers in our center as well, is just keep doing the same incredible work that they're doing every day, trying to have impact, and just kind of be in it for the long run. So, and I think, as Dara kind of mentioned earlier too, there's slim majorities in Congress, and so like big, significant, huge reforms are going to take 60 votes in the Senate and those kind of things. So just trying to find some areas for optimism and just kind of keep pushing forward.
Yeah, I think both of those thoughts are right. Maybe I'll just add, as also, showing my age here and having, witnessed multiple presidential transitions, just to say that if you've been following these issues for a long time, as some of us have been, change is inevitable. And there's ups and downs all throughout the way. This is a long struggle. I will say that the facts are on our side. There is a reason why these programs were created in the first place. There are a reason why these agencies were created. There are reasons why tools like vaccines and medicines and surveillance systems were created. And so, even if there is an open questioning of the value, people will inevitably be reminded of the value. Now, so I don't envision that, it's all going to go away. I do, of course, fret about, lives unnecessarily lost during the period of questioning and perhaps the period of declining support. But I do think over the long haul, the importance of public health programs and why it is in our best interest to invest in them, sustain them, and make sure that they're strong, that will absolutely be made clear. So just to say that this is, you have to take a long view of this, continue working every day, of course. And the other suggestion I would say is that no one person, no one organization can do it alone. This is a time for, it's always, this is always true. This is always true. It is always necessary to collaborate. because none of us has the right answer. And then I would also just say, like, let's just use some humility here, because sometimes we don't have all the answers. We may think it's just clear and it's black and white, but listening to people who disagree with you is actually really important to make sure that we understand, because it could very well be that we have just missed something. So anyway, on that note, I will just say thank you both for your participation. Thank you to the many people who have chimed in to listen. And I am also very grateful to my colleagues at the Pandemic Center, who always make these webinars possible. In particular, Bentley Holt, Michael Mitchell, Leah Lovegren, Amanda Kogan, Carly Gaska, Andrea Ulig, Ann Wang, and Alice Im. Thank you all. And then finally, if you'd like to share this event with anyone who was unable to attend, or if you'd like to see it again, there were questions about repeating things. The recording will be posted on the events page of our website next week. You can also find recordings of all previous webinars there. Please follow our social media accounts, the handles of which are on the screen now, to learn more about our events and future webinars. And please reach out to the email address with any questions or suggestions for future webinars in our Pandemics and Society series. And with that, we are adjourned. Be safe, be healthy, and stay engaged.
Thank you.